Hi, and welcome to another episode of our new medication infographic series. Today, we're going to cover a new medication called Vafseo or Vadadustat. It's an interesting medication. It's part of a newer class of medications. This is the second drug in this class that's now been approved, called hypoxia-inducible factor prolyl hydroxylase inhibitors. Quite a mouthful there. They can be abbreviated as HIF-PH inhibitors. And these drugs basically trick your body into thinking it has low oxygen levels, therefore causing it to produce more red blood cells. So this particular medication is approved to treat anemia that's due to chronic kidney disease in patients who are dependent on receiving dialysis treatment. So this is an oral medication. The more historic medications that have been used for this indication are injectable medications. So that's kind of the new niche area that this drug is going to come in and fill with some cautions. And again, these are meant to be very high level series intended at the pharmacy technician audience. So we're not doing a deep dive into the prescribing information, but there are some warnings. And the biggest one comes around the risk for potential thrombotic events or blood clot events. And these include things like heart attacks or myocardial infarctions or stroke. And other thrombotic events. So there is some risks that do come with these drugs. There's other warnings in the label as well. And these are drugs that really need to be used carefully and dosed carefully, especially when considering what levels of hemoglobin or markers of anemia and blood health need to be targeted when using these agents. A really helpful hint when it comes to this class of medications, and as this class gets a little bit older and is used more, you may start to see this used more in the pharmacy setting. Eventually, it may show up on the pharmacy technician certification exam, and you can quickly identify a HIF-PH inhibitor by the suffix at the end of the generic name. So the common suffix here is Dustat. So Dustats are generally going to be HIF-PH inhibitors. So really interesting drug. You're going to see it soon. If you have any questions or anything like that, feel free to reach out to us at pharmacytechscholar.com.